Access Point. Access Point is a new on-demand business education tool being developed for use by small businesses across the District of Columbia. Access Point is brought to you by the DC Department of Housing and Community Development, DHCD, the DC Department of Small and Local Business Development, DSLBD, District Bridges, and the Rhode Island Avenue Main Street.
Hello, everyone, and welcome back to another episode of Access Point. As part of our ongoing COVID Business Resource Series, we are pleased to bring you some important guidance for small food establishments during the current public health emergency from our partners over at the DC Department of Health. Our speaker today is Victoria Grover, the food technologist with DC Health Food Safety and Hygiene Inspection Services Division. As the food technologist, Victoria is responsible for reviewing and approving variance requests and hazard analysis critical control point plans. And Victoria is the standardization officer for the district and provides some important risk-based inspection training for all the newly hired and existing sanitarians. And she also serves as the liaison between the DC Health and the Food and Drug Administration, United States Department of Agriculture, and other local, state, and federal food safety agencies. So we're very pleased to welcome Victoria to the show today. And I'm just going to hand this over to you, Victoria. Thank you so much for giving us your time today.
Absolutely. Thank you, Kyle. So during this presentation, I will discuss facts and myths during COVID-19, foodborne illness risk factors, food donation and creating meal kits, DC Health rodent control guidance, DC Health guidance for coronavirus, DC Health guidance for symptoms of COVID-19, DC Health guidance for persons who tested positive for COVID-19, DC Health quick reference guide for food retail during COVID-19, and additional guidance from the Centers for Disease Control and Prevention and U.S. Food and Drug Administration. Facts and myths during COVID-19. Restaurants are permitted to sell raw produce, meats, and seafood during this public health emergency. That is a fact. However, food must be properly labeled. Labeling requirements can be found in Chapter 11 of the DC Food Code. Certified Food Protection Manager certificates that have expired during this public health emergency have been extended. That is also a fact. Foodborne illness risk factors. While COVID-19 is at the forefront, I want to briefly discuss foodborne illness risk factors. Foodborne illnesses occur when individuals consume food contaminated with pathogens, which grow in the intestines, causing illness. The U.S. Food and Drug Administration identified the top 5 risk factors that are often responsible for foodborne illness outbreaks. Those risk factors are improper hot and cold holding, improper cooking temperatures, poor employee health and hygiene, dirty and/or contaminated utensils and equipment, and food from unapproved and unsafe sources. Improper hot and cold holding temperatures. Cold food shall be maintained cold at 41 degrees or below, and hot foods shall be maintained hot at 135 degrees or above. Frozen foods shall be maintained frozen solid, and if an establishment cooks and subsequently cools those cooked foods, food shall be cooled from 135 to 70 in the first 2 hours, and from 70 to 41 and the subsequent 4 hours for a total of 6 hours. Please note, it is important to minimize the time foods are being stored, displayed, or delivered, that they are held in the temperature danger zone, which is between 41 and 135. A good rule of thumb is when in doubt, throw it out. Improper cooking temperatures. Cooking foods to the proper temperature is extremely important. When cooked foods are properly cooked, you want to ensure that you measure the proper cooking temperature with a calibrated probed thermometer and inserting that thermometer in the center of food. Once the proper cooking temperature has been achieved, ensure that the food remains at or above that temperature for at least 15 seconds to ensure that most, if not all, of the bacteria are eliminated. Additional food cooking, time, and temperature parameters can be found in Chapter 9 of the DC Food Code. In the next few slides, I will discuss poor employee health and hygiene. It is imperative that employees are in good health while preparing food, because a sick employee can potentially contaminate food. If a food employee reports experiencing vomiting, diarrhea, jaundice, sore throat, or a lesion containing pus to the person in charge must restrict the employee. Restriction means a food employee's activities are limited to prevent the risk of transmitting a disease that is transmissible through food. A restricted employee cannot work with exposed food, clean utensils, clean equipment, linen, or unwrapped single-use articles or items. If a food employee is diagnosed with norovirus, hepatitis A virus, Shigella, E. coli, Salmonella typhi, or non-typhoidal salmonella by a licensed physician or physician assistant, the food employee must notify the person in charge, and the person in charge must notify DC Health, Food Safety, and Hygiene Inspection Services Division. The employee must be excluded from the establishment. Exclusion means a food employee is not permitted to work or enter the food establishment as a food employee. This requirement applies to all areas where food is received, prepared, stored, packaged, served, then transported, and purchased. Continuing on with poor employee health and hygiene, proper hand washing. Proper hand washing is important. Foodborne illnesses are often caused by food workers contaminating their hands and then touching food or food contact surfaces without first washing their hands. When washing hands and exposed portion of arms, it is important to do so correctly. You want to wet your hands with warm water with a minimum temperature of 100 degrees Fahrenheit. Apply soap in either liquid, powder, or bar soap form. Lather hands briskly for 20 seconds. Rinse thoroughly, and then dry thoroughly. Continuing on with poor employee health and hygiene, it is important to know when to wash hands. It is imperative to wash your hands before touching food, utensils, or food contact surfaces. In each of the instances listed in this slide to prevent spreading foodborne illness. Now, in addition to these instances, some additional times when hands should be washed are when switching between working with raw foods and working with ready-to-eat foods, during food preparation, as often as necessary to remove soil and contamination and to prevent cross-contamination when changing tasks, and after engaging in other activities that may contaminate the hands, such as handling trash, and handling money. Dirty and/or contaminated utensils and equipment. When utensils or equipment become dirty or contaminated, they can transfer that contamination to food, causing a foodborne illness. In order to prevent this from happening, food contact surfaces and utensils should be washed, rinsed, and sanitized at least every 4 hours. However, food equipment and utensils may need to be cleaned and sanitized more frequently. For example, before each use with a different type of raw animal food, each time there is a change from working with raw foods to working with ready-to-eat foods, or at any time during the operation when contamination may occur, just to name a few. Now, it is important to use an approved sanitizer when sanitizing food equipment and utensils. Some of those sanitizers are chlorine-based, iodine-based, and quaternary ammonia. For additional information on EPA-approved sanitizers, please click on the link in this. Now, single-use gloves are one of the biggest fallacies. Single-use gloves shall be used for one task and one task only. For example, when working with ready-to-eat food or with raw animal food. Single-use gloves should not be used for any other purpose and should be discarded when damaged or soiled or when interruptions occur in the operation. Food from unapproved or unsafe sources. Food shall be obtained from sources that comply with federal and state laws and any act relating to the adulteration of foods and drugs in the District of Columbia. Any food that is to be sold, served, given away, or used as an ingredient must be obtained from an approved source. Food must be offered for human consumption in a manner that does not mislead or inform or misinform the customer. Food donation and creating meal kits. If you are donating food and creating meal kits for sale during COVID-19, it must be done in a safe manner. Temperature control. Food must be transported to the facility and or customer in a hot and or cold holding equipment and at proper temperatures. You may consider cooling hot foods prior to transport. Shelf life. The starting day for food shelf life is the day on which the foods were prepared. Foods shall be marked with the date indicating when the prepared food must be consumed. That date cannot exceed 7 calendar days. Protecting food from contamination. Now, it is important that when you are preparing these kits or donating foods, that they are stored according to the food hierarchy. Ready-to-eat foods should be on top, followed by unwashed produce, followed by raw seafood / raw meats, followed by raw ground meats, and at the bottom should be your raw poultry. Allergens. Certain foods may contain allergens which can pose harm to individuals who are allergic. Please ensure foods which contain milk, eggs, wheat, soy, fish, crustacean shellfish, peanuts, or tree nuts are properly labeled and separated. And please ensure that any foods that you are using for these kits are safe, unadulterated, and honestly presented. DC Health Rodent Control Guidance. I am certain you have noticed the influx of trash in your neighborhoods. With the influx of trash, there is a potential for more rats. Rats need a habitat, food, and water sources in order to survive. Rats obtain food from open and or overflowing trash cans and dumpsters, also from the exterior ground and flooring underneath or around food equipment. Ways to reduce rats are eliminating their habitat, food, and water sources. You want to ensure that trash and/or dumpster areas are maintained clean. Daily cleaning of food equipment and the flooring underneath and around food equipment. Use garbage disposals instead of disposing food waste into trash cans and/or dumpsters. And contact your licensed pest management professional for assistance. Now, please note, the DC Food Code does require licensed food establishments in the district to have a current contract with a licensed pest management professional. DC Health guidance for symptoms of COVID-19. Symptoms of COVID-19 have ranged from mild to severe. Symptoms may appear 2 to 14 days after exposure. These symptoms are cough, fever, headache, new loss of taste or smell, repeated shaking and chills, sore throat, shortness of breath, and muscle pain. Now, in the next few slides, I will discuss DC Health guidance for persons who tested positive for COVID-19. Here is what you should do to prevent the disease from spreading to people in your home and community. Stay home except to get medical care. Do not go to work, school, or public areas. Avoid using public transportation, rideshare, or taxis. Separate yourself from other people in your home. As much as possible, stay in a specific room and away from other people in your home. Use a separate restroom if possible. Prohibit visitors who do not have an essential need to be in your home. Notify your employer. This is especially important if your occupation requires you to be around older people or people with severe underlying health conditions. Restrict contact with pets and animals. If possible, have another household member care for animals. Wear a face mask if you must be around other people. Cover your mouth and nose with a tissue when you cough or sneeze. Throw used tissues in lined trash cans and immediately wash your hands. Clean your hands often with soap and water for at least 20 seconds. If soap and water are not available, clean your hands with a store-bought alcohol-based hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rubbing them together until they feel dry. Do not make your own home hand sanitizer. Avoid sharing personal household items such as dishes, drinking glasses, cups, eating utensils, towels, or bedding with other people or pets in your home. After using these items, they should be washed thoroughly with soap and water. Clean all high-touch surfaces each day. Clean and disinfect frequently touched objects and surfaces at least daily. Continuing on with DC Health guidance for a person who tested positive for COVID-19, monitor your symptoms and seek medical treatment if your illness worsens. Such symptoms as difficulty breathing, shortness of breath, persistent pain or pressure in your chest, new confusion or inability to arouse, flushed lips, or face. Call ahead before visiting your doctor. Reschedule all non-essential medical appointments if you must go to medical appointments, call the medical provider ahead of time and tell them that you have COVID-19. Visits to healthcare facilities must be by way of medical transport or private vehicle. Do not use rideshare or public transportation. And remember, put on a mask before you enter any healthcare facility. Continuing on with DC Health guidance for persons who tested positive for COVID-19, discontinuing home isolation. Patients with confirmed COVID-19 should stay at home until at least 72 hours after your fever resolves without medication and respiratory symptoms improve, and at least 7 days have passed since your symptoms first started, whichever occurs later. If you test positive but never had any symptoms, then wait until at least 7 days have passed since you were tested. Your actions matter. What you do will help to protect our most vulnerable population. For additional guidance, please refer to Mayor's Order 2020-053 and Mayor's Order 2020-063. Now, in the next few slides, I will discuss DC Health Quick Reference Guide for food retail during COVID-19. Every food retail business must have signage at each entrance, instructing customers on how to keep themselves and others safe. Messages should include wear a mask or some form of mouth covering, such as a scarf or wrap. Avoid entering if they have a confirmed COVID-19 diagnosis or exhibit such symptoms as a cough, fever, or runny nose. Maintain 6 feet distance from each other person who is not part of their household. Quick shop alone or only with household members. Cough away from other people and sneeze away from other people. Do not engage in any unnecessary physical contact. Signage should also provide information on your operation, such as how to access online shopping, curbside pickup, or delivery, if these options are available. Continuing on with DC Health Quick Reference Guide for food retail during COVID-19, the following practices will increase social distancing and sanitization. Limiting the number of customers in your business at one time. Require 6 feet distance from one another in your business. Mark the 6 foot distance wherever lines may form both inside and outside of your business. Inform customers to fill their own reusable bags or bags provided by your business. Block use of payment systems or checkout counters that are not next to one another if 6 feet distance cannot be maintained. Make hand sanitizer available to staff and customers throughout your business and at the entry. And install plexiglass or plastic dividers between customers and employees if the register generally services more than 50 customers per day. Continuing on, these requirements are for sanitization and disinfection. Frequently disinfect high-touch surfaces, such as break rooms, bathrooms, and administrative areas. Disinfect carts and baskets at least every hour. Clean and sanitize all work surfaces, such as self-checkout areas, at least once every hour. And clean and sanitize all equipment and utensils between different employees and between task changes. Continuing on, the following are provisions for your workforce. Inform all employees that they should not come to work if sick. Inform employees of applicable paid leave provisions. Check employees for symptoms before beginning their shift and during their shift. If employees display such symptoms as cough, fever, or runny nose. Require employees to notify the person in charge immediately if they or someone in their household is diagnosed with COVID-19. When an employee is diagnosed with COVID-19, you want to implement your protocols that require the affected employee to self-quarantine and for sanitization of your business. Require employees that have confirmed COVID-19 to present their supervisor with documentation from a healthcare provider stating that they are approved to return to work. Separate all employees' workstations by at least 6 feet. And provide all employees who may come in close contact with each other with gloves and masks. And instruct employees on how to safely use gloves and masks. Now, the next slide. These are examples of signage posted in establishments throughout the district, informing customers of social distancing, face covering and face mask requirements, and the availability of sanitizer at the entry of an establishment. Now, in the next few slides, I will discuss the Center for Disease Control and Prevention's guidance for COVID-19. Cleaning and disinfecting your facility daily. You want to ensure that you wear disposable gloves to clean and disinfect. Clean frequently touched surfaces such as tables, doorknobs, light switches, countertops, candles, desks, phones, and keyboards routinely with soap and water. After cleaning with soap and water, disinfect. However, please follow the instructions on the disinfectant labeling to ensure safe and effective use of the product. A list of EPA registered disinfectants that meet the criteria for use against COVID-19 can be found by clicking the link in this slide. Soft surfaces, carpeted floors, rugs, and drapes should be cleaned using soap and water or with cleaners appropriate for use. Laundry. When laundering wiping cloths or employee uniforms, you want to ensure that you launder per the manufacturer instructions. Use the warmest appropriate water setting and dry items immediately. After handling dirty laundry, wash hands with soap and water immediately after removing gloves. Do not shake dirty laundry. Also, clean and disinfect clothes hampers as well. Electronics. Consider wrapping electronics such as tablets, touchscreens, keyboards, remote controls, and ATM machines with wipeable covers, which will make it easier to clean and disinfect it throughout the day. Continue on with CDC recommendations. Cleaning and disinfecting your building or facility if someone is sick. You want to close off areas used by the sick employee. Open outside doors and windows and wait 24 hours before cleaning and disinfecting to increase air circulation in the establishment. If 24 hours is not feasible, wait as long as possible. You want to clean and disinfect all areas used by the sick employee. Now, when cleaning, wear disposable gloves and gowns. Additional personal protective equipment, PPE, might be required based on the cleaning and disinfectant products being used and whether there is a risk for splash. Gloves and gowns should be removed carefully to avoid contamination of the wearer and the surrounding area. Always wash hands immediately after removing gloves and after contact with a sick person. Educate your employees. Develop policy for worker protection and provide training to cleaning staff prior to performing cleaning tasks. Training should include when to use PPE, what PPE is used for, how to put on and remove PPE, and how to properly dispose of PPE. You want to also ensure that your employees are trained on the hazards of the cleaning chemicals that are being used in your establishment. Continuing on with CDC recommendations, maintain a healthy work environment. Institute measures to physically separate and increase distance between employees, other co-workers, and customers, such as configure partitions, move electronic payment card readers further away from the cashier in order to increase the distance between the customer and the cashier if possible. Use every other checkout lane to aid in distancing if possible. Use verbal cues. Use verbal announcements on the loudspeaker if you have one, and place signage throughout the establishment at entrances, in restrooms, and in break rooms to remind employees and customers to maintain distances of 6 feet from each other. Verbal cues, visual cues. Place visual cues such as floor decals, color tape, or signs to indicate to customers where they should stand when placing orders, when picking up, and during checkout. Control the flow of traffic into the establishment. Consider shifting primary activities to off-peak hours or after hours if possible to reduce contact with customers. If possible, remove or rearrange chairs and tables and add visual cue markings in employee break rooms to support social distancing practices between employees. Identify alternative areas, such as closed customer seating spaces, to accommodate the overflow of employees. Encourage staying at home when sick. Place posters that encourage staying at home when sick, cough and sneeze etiquette, and good hand hygiene at the entrance to the workplace and in other places where they're likely to be seen by your employees. Cleaning and disinfecting. Provide disposable disinfectant wipes, cleaner, or sprays so employees can wipe down frequently touched surfaces. And also require employees to clean out lockers nightly to facilitate overnight deep cleaning processes. Continuing on to recommendations from the U.S. Food and Drug Administration regarding best practices for food retail stores, restaurants, and food pickup delivery services during COVID-19. Follow the 4 key steps to food safety: clean, separate, cook, and chill. Frequently wash hands and food contact surfaces. Separate raw meats from other foods. Cook foods to the right temperature. And properly cool and then refrigerate foods promptly. Emphasize frequent and effective hand washing. Frequently clean food contact surfaces such as dishware, utensils, food preparation surfaces, and beverage equipment. Now, if an establishment has a warewashing machine, they should verify that the warewashing machine is operating as required and at the required wash and rinse temperatures, and with the appropriate detergents and sanitizers. Conduct an evaluation of your facility to identify and apply operational changes in order to maintain social distancing. Consider changing your normal food preparation procedures, services, and/or delivery functions. For example, prepping during off-peak hours or after hours, or rapidly cooling foods for later use. Now, when managing pickup and delivery, You want to consider establishing designated pickup zones for customers to help maintain social distancing, possibly provide remote shopping alternatives for customers, including click and collect, delivery, pickup, shop by phone, just to name a few, to limit the number of customers in your establishment. Now, when foods are being delivered, you want to ensure that they are delivered in an appropriate transport vessel to ensure that hot foods are maintained hot and cold foods are maintained cold. You want to prevent cross-contamination during transport, so you want to ensure that foods are properly wrapped and packaged in a manner that will prevent cross-contamination. And you want to ensure that your delivery vessels are routinely cleaned and sanitized. The information in this presentation and additional information can be found by clicking on the links in the reference slide. So I want to thank you, Kyle, for allowing me to present this information to you today. And for additional information on COVID-19 and the district's response, please visit coronavirus.dc.gov. Thank you.
And thank you, Victoria. This is great information, and we'll check back with you for updates as they occur. Thank you so much for your time today. And thank you, everyone, for tuning into another episode. We hope this was beneficial to you. Be sure and reach out to us if you have any additional questions through our social media, Access Point DC on Facebook and Twitter. Thank you all. Bye-bye.